Hi, I'm Carolyn Holly with Saint Alphonsus. We have the same goal as you, stay out of the emergency department. But if you need us, we're always here. So right now, I want to talk about two things, very important things during the winter that you probably don't think about. They could save your life. So let's turn to the expert right here, Dr. Morrison. Let's start with carbon monoxide poisoning.
Yeah, so a lot of times during the winter there's a need for increased heat in the homes. Sometimes alternate sources of heat are used. Some of these things can emit carbon monoxide, which is very dangerous, and it's not something that you're going to identify readily. You don't smell it, you don't recognize it, but that's why having a carbon monoxide monitor is important. Having that monitor checked to ensure that it's functioning as we kind of enter these colder winter months is very important.
So are there any symptoms at all?
Yeah, so there are symptoms related to carbon monoxide. Sometimes they're subtle, but like headaches, feeling nauseated. As it progresses in the disease, you can have some neurological issues. But primarily, if you're concerned, if there's symptoms that don't make sense, feeling nauseated, weak, some of these things are things that we do consider with carbon monoxide poisoning.
Another thing I want to talk to you about is what happens to some people when all of a sudden they do something they haven't done for a whole year, and that's shovel snow.
Yeah, you would be surprised, but how often that we do see folks that develop heart issues and even heart attacks as a result of being out in the cold weather shoveling their snow. So what happens with the physiologic change during cold weather is that the vessels, the coronary arteries that supply blood to the heart, they get tightened, and if you have some underlying disease, that could result in a heart attack. There's increased oxygen demand and increased effort. Sometimes it feels like a pulled muscle when in fact it may actually be pain from your heart as a result of having some issues there. So we encourage you to take time, to take rest, but certainly if you do develop any sort of chest pain or shortness of breath or feeling weak, lightheaded, dizzy as a result of that sort of work, that's something that really requires a visit so that we can assess it. Oftentimes we can identify some issues before they become an issue.
That is so good to know and such valuable information. So I promised I'd share those two things with you. Stay safe, stay healthy, and we're here for you at Saint Alphonsus.